Dr. Shankar, Professor and Head of the Department of Community Medicine, and other faculties of Community Medicine Department who have gathered here, and all the participants of this CME program. Good morning to all of you. The topic which has been given to me is one of a very important, and historically this disease is really a different type of disease. As you can see in the slide, of course this is a rabies virus, and electron microscopically you are seeing the real rabies virus in the culture. 4,000 years before, in the era of goddess Gula, you can see presence of a dog right at the feet of the goddess Gula. So the man domesticated and lived along with dogs for quite some time, is it not? There is another thing in 1930, before Christian era, BCE, the tablets, the laws of Ishwana. So here also you can see these tablets, it is written, the inscriptions are there regarding something like this. A dog becomes rabid and the ward authority makes that known to its owner, but he does not watch over his dog, so that it bites a man and causes his death. The owner of the dog shall pay 40 shekels of silver. If it bites a slave and causes its death, he shall pay 15 shekels of silver. Discount for slaves who are bitten and dying because of rabies. So that culture that time is something like this, slaves and things like this, punishment. So the inscriptions can be seen long before. Again, coming to the Middle Ages, this is AD 1020-24. Kitab al-Kaish, Arabic translation of the Materia Medica. The Middle Ages, you can again see a dog biting a man and causing death. The Arabic inscriptions are there, which says that, of course, the rabies was there for quite some time, right from ancient times, historic times. The virus we saw was there, is there still today, is it not? Even Sushruta Samhita, our medical text, also has inscriptions which says something very similar to rabies encephalitis. Stabda Shefa, penile rigidity, Shukra Moksha, excessive ejaculation, Marana, Jwara, something very much related to rabies encephalitis. So, after 4,000 years, still today, rabies remains one of the most lethal diseases of mankind. What is the most important thing here in rabies? Once the virus enters our body, so what happens? Inside the body, the dog bites here, what happens? It is the race against which one will reach first. The virus, whether it will reach the nerve first or the vaccine will kill the virus before it reaches the nerves and enters the brain. That is the only thing. But if it reaches the brain, there is no turning back. It is 100% mortality. See, the modern medicine still has not offered no tangible solution for rabies. Once it enters our body, there is no point of cure. There is no medicine available. There is no antibiotic available to halt the multiplication of this virus. And why this is happening? That is the question that will be answered in the end. There are some scientific studies which are answering this question. Why still it is there in rabies? Because rabies is not like corona. Corona has come like a wave. It just came like a wave. It just spread like a wildfire. It infected a lot of people. And then now we don't see much of corona. But the rabies has a different characteristics which we will see later. So the scientific understanding right from ancient times, there are so much scientific misconceptions. Like before, they used to give dog hair. If a person has rabies, the person used to eat the dog hair. Then another ancient thing, 19th century idea from Italian, Monsignor Stotti, set up brothel for dogs because it is believed that canine sexual frustration, which led to rabies. So a lot of misguided theories. Despite this, the ancient awareness of presence of a disease, its scientific understanding started happening only in this century. Which century? I have put a dot here. Which century it is? Which miracle century? Because this is a century where so many things were discovered. So many things. Yes, 19th century. It is that year, that is a century, somehow some brains suddenly were different in that century. We don't know what is the reason, but that is a century of innovations and discoveries, so many. Similarly, rabies also saw some scientific understanding only during this 19th century. So here they found some 99% of the problem, the death due to rabies, is because of dog bite. Even though we say a bat, horses, various mammals can carry the virus, but still it is the dogs which is predominantly responsible for the death. And now, what is the understanding? No electron microscope, no microscope discovery that time. So we don't know whether it is a virus or something. So they know something from the dog, some poisonous thing from the dog saliva is causing rabies. So that is the understanding. So what they did, they took that saliva and that is the year of that century saw the first vaccine known to mankind, which is smallpox. So thereafter, Louis Pasteur. So the Louis Pasteur, he came with some understanding that something a poison from the mouth of the dog, if we attenuate it, same concept like smallpox, just attenuate it further the toxicity and try to reduce the virulence of something that is there, and then try to retain the immunogenicity. Not real immunological theory, but it is trial and error method of Louis Pasteur. But they tried something, and what he did. So this is a thing. The method they used to follow is what he is carrying in his hands. Dog, rabbit. The rabbits. He used to inject that poison, whatever poison. I will put in the same words of Pasteur. That's whatever poison from the mouth of the dog, he used to inoculate in the rabbit spinal cord, infect the rabbit spinal cord, and then make it to multiply and then die, and the rabbit dies. Then take that cord blood. From that cord blood, he used to deduce the vaccine. Okay, something he did, and ultimately it was tested on this boy, the first person in the world to receive a vaccine. This boy, Joseph Mister, at the age of 12 years, was bitten by dog 12 times. His right hand and face, everywhere the dog bit him. And that time it is no point of return. If the dog bites, death is sure. Only thing is it will take between 2 to 3 months. You know, the incubation period and death time between the thing is distant because of it's a slow virus disease. So this boy was given this vaccine by Pasteur and his team on July 6, 1885, 8 p.m. and thereafter, he received 14 times, he received 12 shots of the same vaccine thereafter, and miraculously, the boy survived. So this is one of the really shook the scientific community at large. Really, something like this could happen. Nobody really believed, because you saw 4,000 years it is there. But the boy survived because of this miracle cure. That's why he was hailed so much. He's like portrayed as a hero with an injection vaccine in his hand, and dogs are killed. So dogs are killed. He was described as an angel. And this concept spread worldwide. And thereafter, Pasteur institutes were set up all over the world. In 1891, outside Europe, in Asia, the first two Asians to receive the vaccine and survive. Along with Albert Calmet, who established the Pasteur Institute, two patients received the rabies post-exposure prophylaxis outside the Europe. So then Africa, Latin America, everywhere people were immunized. Pasteur Institutes were set up almost by 1909, 75 Pasteur Institutes came all over the world. Okay, so that somehow this is the history, how it happened, and what is the advancement. Thereafter, if you see, only the vaccine is still our tool in our hand to combat this disease. Still, we don't have a real action tool to kill the virus, which is highly potent and virulent. Today, see, after 4,000 years, still half the population of the world is still under the threat of rabies. Only continent in the world which doesn't have rabies is Antarctica. Except Antarctica, all continents have rabies threat. 59,000 deaths still occur every year. And most of the deaths occur in Asia, 59.6%. In this Asia, you have to remember, India has the highest number of rabies deaths in the world, 33.6%. 33% of world's total rabies death occur in India. So unless we understand certain things, we are also susceptible to rabies. Remember that. So all countries, this is a WHO map showing the rabies. See, among these rabies victims, 40% are children under 15 years. It's another pathetic situation. And see, the elimination targets are there. But we are postponing the target. 2020, they kept the target. We will eliminate. Southeast Asia, we will eliminate. Western Pacific, we will eliminate. Again, it is shifted to 2030. Postponed. We are yet to actually really bring down that level. Why is the question? That is a very interesting answer for the question is there from research. Of course, these things will be dealt with by Subsequent speakers, I suppose, what are the bites, category of bites? We have three warriors to combat rabies bite. What are they? Yes, excellent. Local wound care. Thank you, sorry. Local wound care, immunoglobulin, and vaccination. So these are the three things. So India follows modified Thai regimen. It four is given. Four vaccines are given. I mean, 4 times it is given, but 8 shots. Remember, modified Thai regimen is a intradermal regimen where we give once a patient comes, this side, like this, both sides they will give. So totally 8 doses, modified Thai regimen, and depends upon the bite, whether it is licking, or whether it is a deep wound, location of the wound. So it all matters. And wound washing. There is a proper method for wound washing. So we will come to these things. How it is so much important, we will come to in the subsequent slides, but you all know this: category 1, category 2, category 3. And there is 2 types of prophylaxis. One is pre-exposure prophylaxis, mainly for animal handlers, veterinarians who are already at risk of getting a dog bite. They are at risk. And another thing is post-exposure prophylaxis. What is the concept behind post-exposure prophylaxis? After the bite happens, why we give vaccine? We stop. But compared to other diseases, why here post-exposure prophylaxis will be effective? Yes, excellent. It is a slow virus. Rabies is a slow virus. It will take, and on average, 90 days, 60 to 90 days. And almost 1 year is the incubation period sometimes. So it all depends upon how much, the time interval which nature has given is the only gift as of now against rabies. The time interval is not there, means imagine, it is very, very deadly. Immediately the person dies in 1 week, within 1 week, same like any other diphtheria, cholera, like same like any other things. If it develops, we don't have the time interval. But here the only thing the nature has given here in this virus is the time gap. Because of this slow virus progression, we are giving post-exposure prophylaxis, trying to either kill it locally by giving 15 minutes of soap washing or Dettol or antiseptic, 15 minutes continuously, not stitching the wound, and then giving immunoglobulin if it is a severe bite around, so that in the locally itself we are trying to kill the virus. If not possible, after that we give vaccine. So if it enters, the remaining vaccine will be killed if it enters the bloodstream. So only thing is it should not enter the nerve and travel straight to brain. In that scenario, we cannot do anything. So epidemiology, we will come to India. What is the India status? So India, it is about in 2021, 59,000 deaths. So 33% of the global total, and 96% of the fatalities itself from dog bites. Sometimes, other than dog, the another thing which can transmit rabies mostly is bats. Yes. Bats, very good. So the map of rabies, chloropath map showing dog bite from January to October 2022. You see 1 to 100 number of cases here. In Tamil Nadu, Andhra Pradesh, they have given. Okay, but 1,001 to 10,000, Maharashtra, Gujarat, Jammu Kashmir, Jammu, and more than 10,000, Punjab, Kerala. Kerala recently was in news for rabies. I hope if you are reading newspaper, you will be knowing this. There's a lot of furor regarding rabies. And why so much? More than 10,000 cases in a small state. Rabies death in Kerala sparked a real outrage, wide outcry among the people. Every year we saw, like 2021, we saw suddenly 11 cases, 11 deaths. Even though there are a lot of health education pamphlets, 100% fatal but preventable. Do not apply chili, mustard oil, or any other irritant on bite. Do not apply dressing. Do not get the wound stitched. Consult your doctor immediately. Rush to nearest rabies clinic. Complete the course of anti-rabies vaccination advised by your doctor. In severe bites, combine anti-rabies vaccine and vaccine therapy. All these things are there, but it didn't reach the community. You have to remember, even though 100% literate state like Kerala, there is so much gap in knowledge regarding rabies. People didn't do proper wound care. They are telling the reason for deaths. So many factors. One thing, after Corona, the dog population has increased drastically. The dog population has increased drastically because the feeders, the owners tended to neglect the dogs maybe. So all these things are maybe. So the dog population increased. Then people didn't took care of the wound care. People didn't follow the vaccination. They didn't go to the doctor. They didn't get the vaccinations. All these factors were told. Not only this, after corona, the another strategy to control rabies is, can we kill all the dogs to control rabies? What it is called? Killing the dogs. So why bother so much? Why don't we kill all the dogs? Culling, C-U-L-L-I-N-G, culling method. Is it okay? As students, if it is okay, you can raise your hand. If it is not okay, raise your hand. It's a good thing. Yes, it is not only ethically wrong, but scientifically also, I will tell later why it is ineffective. Okay, it is not effective. Culling is not effective, but instead, our country is following one program called ABC to really control population. What is that ABC? Animal birth control. ABC. See, ABC scheme is being implemented very vigorously to control the dog population, but I will tell you that is not a really effective method. What is really the effective method? We will come to it little bit in a while. See, the rabies by stray dog bites claimed 47 lives in Kerala in the last 4 years between January 2020 and January 2024, revealed by a response from the Office of State Health Directorate to Right Information. இது போட்டாதான் நம்மளுக்கு கிடைக்குது information, RTI. This was in addition to 22 more lives probably lost to rabies, according to the response received by this RTI activist. The highest number of 10 confirmed death was reported from Kollam district, followed by 9 in Thiruvananthapuram. They are the southern districts of Kerala. Kollam is, I think Thiruvananthapuram is the southernmost part of Kerala. Little above is Kollam. So these things are very important. Why the location is important? Number of people who have sought treatment across the state for stray dog bite has also progressively gone up. See, 1.6 lakh people sought treatment in 2020. Then the dog bite treatment number of cases rose to 2.21 lakh in 2021. Then 2.88 lakh in 2022. Now in 2023, 3.06 lakh. So it is gradually increasing. So that's why the title of this presentation is Rabies Resurgence. Reemergence is happening basically. In the first month of 2024 alone, 26,000 people sought treatment for stray dog bite. Approximately how many dogs are there in India? Approximately. Yes? Just one number. India has about 62 million approximately stray dogs and 37 million, almost close to 100 million, which is 10 crores. Approximately the dog population in India is 10 crore. This is a recent tragedy. In May 2024, this boy, the dog didn't do any real damage, mild abrasion. So actually they didn't go for this in Kerala, Alappuzha. Yes, Alappuzha. The boy didn't go for actually vaccination. He was not vaccinated after the attack owing to the absence of major wounds, but the boy died, okay, because of rabies. So this neglect, even though we saw 2021, 2022, 2023 number of cases, still that neglect is still there. Now, what can we do with regarding this? One thing, these dogs, where they are taken, these are temporary dog shelters, and the dog shelters they are given, ABC program also is being carried out. So this we discussed. One thing is vaccination for us, but another thing is vaccination for dogs is also should be made. India is currently following the updated Thai Red Cross schedule, intramuscular or intradermal. See, post-exposure prophylaxis, we give 8 doses. 8 intradermal doses, 2 sites per visit, 0, 3, 7 and 28 days, or 5 intramuscular doses on 0, 3, 7, 14 and 28 days. Those who receive the pre-exposure prophylaxis, suppose you are working near to a veterinary center, you are working along with them, then you will get a pre-exposure prophylaxis. All the 5 doses will be given, IM doses. Thereafter, if you get bitten by dog, after you get the pre-exposure prophylaxis, if you get bitten by dog, then that time the number of doses will reduce. Only 2 doses. And even immunoglobulin is not necessary that time. So this will reduce the cost and vaccine requirement. The probable reasons for the Kerala surge, this we discussed. In Kerala, rabies death among vaccinated individuals were due to nature of wounds and failure to seek prompt care. Awareness about first aid measure after animal bite in the country is inadequate. Only 38% of the animal bite victims, animal bites reported washing wounds after biting with soap and water. Remember this point, WHO recommends flushing and washing the wound with water, soap or detergent or povidone iodine or other virucidal agents for a minimum of 15 minutes. Dedicatedly they have to wash. But people tend to என்ன அப்படியே கழுவிட்டு வேகமாக ஹாஸ்பிட்டலுக்கு ஓடணும்னு நினைப்பாங்களா இல்லை வாட் இஸ் த ரீசன் வி டோன்ட் நோ பட் that awareness is not there, should be improved, is it not? It's very, very important. Even in the, we will come to Tamil Nadu in the next slide. Pre-exposure prophylaxis should be advocated for high-risk population and children having less access to post-exposure prophylaxis, and where incidence of dog bite is greater than 5%, they are recommending even pre-exposure prophylaxis because it's becoming a problem day by day increasing. See, see the two countries where the rabies death are more. One is India, another one is Africa. In Africa, if you see, even though they are underdeveloped, but still they have lot of domesticated dogs, not street dogs. Street dogs are less. Domesticated dogs are very high. So each and every dog can be enumerated actually. But India only, this type of menace is a even bigger problem. Street dogs and the free roaming of dogs, nobody has really an understanding of how many are there and what is their population. So that is a big trouble here in India. And the concerns have been raised about the mismanagement of street dogs in terms of vaccination and birth control activity. Two things that should be done for these dogs is, one is birth control activity, ABC program. Another one is vaccination of the dogs. But why it is not being implemented? In India, an increase in aggression among dogs has been observed post-pandemic, resulting from food shortage, abandonment of pets, decrease in human-dog interaction. Now coming to Tamil Nadu. இப்போ தமிழ்நாட்டில் என்ன சிச்சுவேஷன்? கேரளாவுக்கு கொஞ்சம் கூட குறைஞ்சவங்க இல்லைங்கிறது மட்டும் இல்லை, we are more, number of deaths are more in Tamil Nadu compared to Kerala. Please remember, in Tamil Nadu in the last 5 years, from the case investigation form published in State Public Health Journal, researchers of the DPH and preventive medicine took a closer look at 121 rabies-related deaths that were registered in the zoonotic division of DPH. There are about, in the past 4 years, we have about 121 deaths. Again, in Tamil Nadu, what is the situation? See, 3 districts that reported the highest number of deaths were Salem, 14, நம்மளுக்கு கொஞ்சம் தூரத்தில் இருக்காங்க பக்கத்தில். மதுரை 11 cases, தூத்துக்குடி 9, most. 80% of the victims were men, 97 were men, and 20% of them were aged between 41 and 50. 40% almost were attacked at home, and 40% on streets. So equal damage, be it home or street. And 83% dog bites constituted the major cause of death due to rabies, and 73% are category 3 bites in these deaths. So what did they do? These patients, before they died, what treatment was given? Just a post-analysis. After the death, what has happened? What treatment they received? Only local wound care was sought only by 20% of these people. See, 121 பேர் இறந்திருக்கிறாங்க. But 20% only took a proper wound care. It's significant, is it not? 13% of the victims and 13% of the victims received care immediately. Only 13% received the care immediately among these 121, which clearly funnels our focus towards wound management here. Then tetanus toxoid was administered to 28%. PEP, post-exposure prophylaxis, was not taken by 73% of the victims. Another most important thing, only 27% or 26% received the vaccine, post-exposure prophylaxis. Imagine, even though we saw in the previous slide about 76% were category 3 bites. Category 3 bites irunde, this number is grossly less. We don't need any statistical analysis to find a significance here. Is it? So we are statisticians. We try to find the p-value. Here there is no need for any statistical analysis. Straight away the data is just glaring at us very clearly that there is no vaccine given. Only 17% received the anti-rabies vaccine. Aduliyum only 1% completed the dosage. Imagine 121 people ஒரே ஒருத்தர் தான் 03728 schedule complete பண்ணிருக்காங்க. Equine rabies immunoglobulin was administered to 3%. Human rabies immunoglobulin was given to 1.7%. So the duration between the animal bite and death was available for 79 victims. இது எல்லாருக்கும் தெரிஞ்சது. Average 30 to 90 days between the bite and the death. This, so I told you why that question of why it is still there. 4,000 years presentation ஆரம்பிக்கும் போது இதான் சொன்னேன். 4,000 years ஒரு virus இருக்கு. We are unable to actually completely eliminate it, even though it is only among the dogs. So this question was addressed by this lady. She did a very interesting study. We can say it's one of the landmark studies for rabies. Katie Hampson. This Katie Hampson, what she did, she did a PhD. A PhD project is rabies. So she tried to find out the rabies, why it is occurring. The basic question of her project is, what allows a lethal disease like rabies to persist long term at low levels? What is the reason? This Katie Hampson posted before for her PhD is, what is the reason? What is the reason? 4,000 years the disease is there, the virus is there. Why for all these years the virus is still persisting in the community, even in this world, except Antarctica? All countries of the world have rabies, and India has 33% of all rabies related deaths in the world. So the question is why? She did a very, very interesting study. So Dr. Hampson established a contact tracing network to trace the rabies among 50,000 dogs and 250,000 people in the Serengeti district of northern Tanzania. Okay. So she wanted to actually see the behavior of the dogs, the rabid dogs, after they bite the person. So the person will come to the health center. She interviews in the health center the bite victim, asks which dog bite. I told you a short while ago, most of the dogs in Africa are homebred, domesticated. They have a number. Actually, you can trace back these dogs, but India, it is very difficult because the stray dog population is very high. So here what she did, she took this people and interviewed what happened to this dog. On an average, the dogs which bit a person, when she went back, either they are rabid, they are already affected with rabies. So definitely they will also die. Before they die, on an average, they bite another few dogs in the community. Like she did a mapping of this Serengeti district and tried to trace where these dogs bite, where these dogs go, and how these dogs die. 2-3 bites before they die. If they bite another 2 dogs, the another 2 dogs will be another 2, 4, 8 like that. If it multiplies, then our mathematical modeling, we can clearly know, oh, this is the density of rabies. This is the density where we have to concentrate. But she found a surprising finding in this study. The dog behavior played a major role here. She followed the chain of transmission. Usually like COVID, it spreads like wildfire. So many people at a time will be affected and they recover from the disease. Either they develop immunity. So there is a ring of herd immunity formed around the people. Now we don't see COVID. But for rabies, the only way it can spread between dog is by a bite. The researchers found the spatial structure of dog population and the scale at which the virus spread is very important. Our understanding that it will spread only locally is wrong. What they found are certain super spreader dogs are there among this. These super spreader dogs, what they will do is, they can say only few dogs bite 1 or 2, but some dogs, one dog biting more than 60 dogs. Imagine, we saw in Tamil Nadu, Salem is affected. What is in another district? Madurai is affected. So they are all situated far away, so many kilometers away. So here in her study, she found certain super spreader dogs can travel 15-20 kilometers before they die. In the process of they can bite more than 60 dogs. So this is a very significant finding, super spreader dogs. So simply taking the average of how many dogs were bitten would have led the researchers to miss this super spreader dogs. So the infection can actually persist at a low level. They are like sparks from a forest fire. By traveling long distance, dogs ended up being a vehicle to carry the virus away from the local community. Even if you cover the rabies is there in Salem, so you cover the full Salem district. So there are certain dogs that could have transmitted next to Athur. Then from Athur, if you cover Athur, there could be Talaivasal that the dogs would have carried. From Talaivasal, it can come to Perambalur. From Perambalur, it can come to Samayapuram. So there are the concept. This is a concept. They say the low levels of maintenance of rabies always in the community is because of the dog behavior, which is very different. So this is what is found by Katie Hampson's study. So the solution, she says, there is absolutely no use in killing every dog. Culling of dogs is definitely not a solution. Culling is a waste of time because we already discussed this. Culling of dogs means India has a population of 10 crore dogs, 62 million stray dogs, 37 million domestic homebred dogs. So it is impossible for covering these things, all the dogs. The only effective strategy from her study, Katie Holmes's study, is this. If you cover more than 70% of the dog population by vaccine, that is the only effective way to actually control the spread of rabies. So there is no other option. India is vigorously following ABC program, not vigorously. India's main strategy is to reduce the dog population, ABC program, animal birth control. But it is not proving to be really so much effective. What India needs to actually concentrate more is vaccination. That too, not post-exposure or pre-exposure prophylaxis of us, but of dogs. But there are certain practical hindrances in doing this. What are the major practical hindrance? There is a separate chart, vaccination schedule for dogs. The major hindrance is the dearth of vaccines and the government policies. See, what is the most important thing? There are mainly 7 manufacturers of this vaccine in India. So the biotechs, Cadila Pharma, Serum Institute of India, what they are saying is managing the supply chain. For humans itself, there is the proper vaccines are not coming on time. Like last year, Serum Institute of India discarded the vaccines owing to lack of demand. So the supply chain, there is a problem with the supply chain of the logistical component of India's vaccination. So most of the vaccine is manufactured for the world from India only. And the manufacturers tend to export more. The pricing is more because of export, and most of the vaccines are exported more, and locally available vaccines are less. And second thing is that certain states are not placing correct demand. Like North India, we saw this chlorophyll map. Certain states don't have in India problem, but certain states have problem. So these states, though they also send vaccine to these states, but the demand is very low. But these states where the vaccine bites are more and demand is more, they are not placing on time. So this is what they are telling. There are so many gaps here in pricing and managerial strategies, which led to which is leading to dearth of vaccination, which should be addressed. Very important. Managing the supply chain and pricing challenges is a very important component of rabies control. So I hope as students gathered here, the most important things for further research in this area, rabies, to control rabies. Now this is a phase of rabies re-emerge. Lakhs and lakhs of people are getting infected again, and it is spreading. And you understood certain things scientifically because of research, how it is spread, how it is maintained at low level in the community. Now certain key areas which you can take up for research, like why that local wound care is very less. We saw in Tamil Nadu, out of 121 deaths, only 13% received local wound care. They didn't even wash the wound for 15 minutes properly. How to increase this awareness? Secondly, only very few number got vaccine. First of all, they didn't go for vaccine. In that, only out of 121 deaths, only 1% received the full 0, 3, 7, 28 vaccine schedule, modified Thai schedule. Why it is? How to reduce that? How to improve that health-seeking behavior? Thirdly, how to increase the vaccination component? How to increase the vaccination in dogs. So these are the major things which should be addressed. Only if we address those things, we will be able to control the rabies problem in our community. The One Health approach, the collaboration among veterinary, medical and environmental sectors play a major role. Our dream is to achieve zero rabies death by 2030. If you want to achieve this, India needs a robust surveillance mechanism, GIS-enabled tracking, ensuring successful coordination among key sectors. Medical fraternity should manage the cases properly. Veterinary fraternity should manage the control of rabies ABC program as well as vaccination component. The environmental sectors should play together. They have to do this tracking, GIS-enabled tracking, to find those super spreader drugs, super spreaders, try to control this properly. Because we have technology now at hand. Just use your mind. We can use this technology to identify this dog behavior and we can control it, but it needs some dedicated time, effort, money. So those are the things that is needed. So I hope I have covered about rabies.